In depth this morning, the Hollywood stars have them, and now everybody else wants them. I'm talking about those pearly white teeth. You know what I mean. Go to your local store, your dental office, and you know exactly what I'm talking about. Experts say, however, that there is a hidden price to pay for using teeth whiteners. And one of the most common side effects is tooth sensitivity. Krista Hines was a regular user of whitening strips, and now she complains that there's pain in her teeth.
I started to feel my teeth felt like they wanted to just fall out of my mouth. It just felt they got real sensitive.
The FDA does not regulate dental whitening systems because they are not considered drugs, so it is important for the consumer to know exactly what they're buying. Now, to help us sift through the many products out there, we turn to dentist Dr. Konig. Thank you so much for coming in.
Thank you for having me.
This has been quite an explosion because I remember growing up, and I don't remember how, going through my store shelves and seeing whitening this and whitening that. It was more about plaque and gingivitis. What's going on?
Everybody wants whiter teeth. We may not have a white Christmas in Houston, but you can get white teeth. There's been a huge explosion in the number of products out there. And some are good, some are bad, and there's pros and cons of everything.
Well, let's start with the basics. The tooth whitening toothpaste. What do you say about that?
The tooth whitening toothpaste are primarily going to maybe take care of some external stains or new stains. They won't go deeper to get some of the darker stains out.
Okay, and then let's move on to, we've got some white strips. Do those things work?
That depends on the patient, and it depends on the product. There's so many products that you said it's not FDA approved. Some of these products may have been exposed to heat, which makes them non-effective. The other problem with the teeth have like porosity in them. A lot of times they need to be conditioned prior to bleaching. And so some of these products will work, other ones won't. Most professional products have better regulation.
Well, let's talk about some of those professional products. What do you recommend when someone comes into your dental chair?
Well, I try to work with the patient, but there's several issues. Through the years, with this boom, people have been a little more geared toward getting a quick, fast result and not wanting to use compliance. So there's in-office bleaching, which can be an hour and a half, and they can be done and having the finish. If they want deep bleaching, sometimes we have to continue with bleaching at home with professional trays. Again, it's compliance. If the patient doesn't want to do that at home, they're taking the one step. It works, but you can continue to get whiter teeth.
Now, we were seeing video of someone, they were using that blue light. I got them done a while ago. And I got to tell you, I went home and I felt as if all of my teeth were going to fall out. I mean, it was that sensitive. Why the sensitivity?
Well, teeth have pores in them. The bleaching solution actually can get through the pores or get on the roots of the teeth. Every case is different. If you have root exposure, you're definitely better off doing professional bleaching, but they have solutions you can put on the teeth while you're working on them to stop that sensitivity. There's a lot of professional products out there now that have focused on the sensitivity because of that issue. So we haven't had a real problem with the sensitivity, but it certainly is an issue. Some of these products over here can be used in conjunction with bleaching to help control that.
Okay, well, any big no-nos?
Regarding bleaching?
Yeah.
I would think professional care is much better than doing it over the counter. You don't know what you're doing in the teeth. You don't know if there's decay, the cavities, the gum disease. So getting a professional examination first prior to bleaching of any type is definitely indicated.
Well, Dr. Konig, thank you so much for your time. We appreciate you being here today, and keep up that nice bright smile.
Thank you. Thank you.
Jose, back to you.